So, welcome to the Vivekananda Yoga's yoga webinar on reproductive health, women's reproductive health. And before we get started, we'll do a short, like 2 to 3 minutes mindfulness exercise, sort of breathing, some our starting prayer as we generally do in Vivekananda Yoga. So let us sit comfortably, back straight, shoulders relaxed, eyes closed. And become aware of our breathing. As we breathe in, we know we are breathing in. As we breathe out, we know we are breathing out. Just gentle, easy, rhythmic, slow, very comfortable breathing. A few breaths, and as thoughts come, we just let go of the thoughts and bring our attention back to the breath. Now with the next inhale, upon exhale, we will chant Omkara 3 times. Take a deep inhale. Let's bring our hands to our heart center. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. The meaning of this prayer is that we may all be protected, nourished, may we have great energy to achieve a lot of things together, may there be no disagreements between us, and may there be peace. So we'll bring our hands back. You can do to the extent you can, slightly lean back and come forward. And if you're on the floor, you can see if you're able to touch your forehead to the floor. If not, to the extent that you can. And gently come up with an inhale. And release your hands, rub the palms. Gently cup around the eyes. And we'll get started. Namaste again to those who joined shortly after. My name is Shubhangi Yogi. I'm one of the teachers here at Vivekananda Yoga, and today we have a webinar on women's reproductive health. I'm going to guide you through a short introduction of the presenters today and about what the School of Vivekananda Yoga is all about, and then we could get started with the main part of the webinar itself. So I'm going to present my screen. Okay. I hope everybody can see my screen right now. Okay, so as we all know, we are here for reproductive health, women's reproductive health to be specific. Vivekananda Yoga is the school that's bringing this to you. And the goal of Vivekananda Yoga is to promote a healthy lifestyle, to conduct classes for adults to promote stress reduction, healthy living, teach them yogasana. Overall, health and wellness is the whole purpose behind all our activities. We spread awareness on the benefits of yoga, active and healthy lifestyle. We invite experts in the fields, in different health fields, to train volunteers for promoting our mission and vision, such as the one that we have organized today. We also seek to promote mindfulness among adults and children through the practice of yoga. Our Guruji, Subbarav Nemani, is our founder, and he is the main, he provides us the direction and the vision for what we do. He's been teaching yoga for decades, and he was a former faculty of S. Vyasa University, Bangalore. And he has been trained in various other schools in India and here. And the best part of Guruji is that he practices what he teaches us, and his great agility, health, and ability to do a lot of things at his age is what inspires most of us to follow in his footsteps and actually, walk the walk, and not just talk about it, but we also practice it. And Guruji combines a lot of different schools of yoga to present us a version that is very easy to follow, and that is full of common sense. He meets students where they are, and we derive a lot of benefit from Guruji's association and his leading us. Dr. Ketan Patel is our keynote speaker today, and he is our subject matter expert who will be talking to us about fertility and women's reproductive health. He's a founder of Arizona Associates for Reproductive Health, and he is board certified in reproductive endocrinology and obstetrics and gynecology. He earned an MD from the BJ Medical College, Gujarat University, residency at Cook County Hospital in Chicago, Illinois, and a fellowship at the University of California in San Diego. Dr. Patel formerly was a medical director for reproductive endocrinology for the Mayo Clinic in Phoenix. Welcome, Dr. Patel. We're so happy you're here with us. Dr. Rashmi Pradhan Vaidya is our own teacher here at Vivekananda Yoga, but she's also a surgeon oncologist. And she's double board certified surgeon trained both in India and the US. She currently works as a breast surgical oncologist with Ironwood Cancer Research Centers in Phoenix, Arizona. She did her general surgical residency at Seth GS Medical College and KEM Hospital in Mumbai, India. She completed another surgical residency in general surgery at St. John Hospital in Detroit, Michigan, and she did a fellowship in the breast surgical oncology from the Cleveland Clinic. She also trained minimally invasive breast procedures and cryotherapy in Japan. She considers herself lucky to have discovered yoga and became a yoga teacher after training with Guruji Subbarao. She practices yoga and also teaches with Vivekananda Yoga and with Seva Phoenix. She educates the public on evidence-based informative webinars such as this one to share the medical benefits of yoga as a way of life. So she will be bringing us the bridge between medicine and yoga, specific to this topic, but also overall health in general. Shubhangi Yogi is going to be the yoga asana presenter today. She's a very adept yoga asana teacher and a practitioner. She's been involved in a lot of sports, Mallakhambh, and the NCC, the National Cadet Corps, in her childhood, which really, sowed the foundation for her yoga practice later. She totally enjoys working with our Guruji Subbarao, and she really is into the asana, pranayama, and meditation aspect of it, not just the physical aspect, but also the mental and spiritual benefits of yoga. She hopes to follow in Guruji's footsteps to bring authentic and traditional form of yoga to people all over the world. In addition to yoga, she enjoys dancing, hiking, running marathons. She's a makeup artist, cosmetologist. She volunteers with HSS and with Seva International. So the Dr. Patel, Dr. Vaidya, and Shubhangi Yogi will be our presenters today. And the agenda is going to be, shortly after I finish, I will be passing the baton over to Shubhangi. We will do asanas for about 45 to 60 minutes. And then we will have a short talk by Dr. Patel on pointers for fertility and reproductive health. And then it will be followed by Dr. Vaidya on the importance of yoga for overall health, with a focus on factors that affect fertility. We will have questions and answers, which we will be inviting all the participants to post their questions on chat. I will also be sharing a number that you can WhatsApp to if you wish to be anonymous. And if the question is of a personal nature, we'll have one of us just read the question out on your behalf. And then we can talk to you about next steps, what happens. Obviously, we're not going to see drastic results through yoga in a 45-minute session, and we can offer you some options at the end of the webinar. So some housekeeping rules. We would like for you to be in a nice quiet place for about 2 hours, so that you can totally focus on all the different aspects of it, both the medical and the yoga aspect of today's webinar. Stay muted, please, and keep the video on if possible. We'll have a few of the teachers try and see if everybody is doing the asanas correctly. So if in doubt, you can maybe come to the chat window and post a question, or do monitor the chat. We might offer some pointers and suggestions if we see that a lot of people are doing things incorrectly. But as always, it's hard for the teachers to look at everyone depending on the angle and the way it can be seen. It's not possible to offer perfect corrections to everyone, so we really urge all the participants to show discretion, to be aware of what's going on, not push the body too hard, especially if you haven't been practicing for a while, to take it easier today. And the endurance, strength, and flexibility do increase over time. Like I said, the questions can be posted in the chat, and just being aware of the breathing and here and now in the moment sort of a practice is best. And if at the end of the webinar you find yourself not wanting to ask something but not able to get to it, you can email us. I will also copy this email and post it in the chat in case you want to keep it handy and refer to it at a later time. And do let us know if you have any questions. We're always here, and we're happy to answer them. We'll all be monitoring the chat pretty closely. So on that note, we'll move on to the asana part of the practice. I will stop sharing. So Shubhangi, you can take over.
Okay, namaste everyone and welcome Dr. Patel. So good to see you. So everyone sit comfortably in Sukhasana, Padmasana, any asana which you feel comfortable today. Again, one more request to all of you, if you are performing the asanas, please keep your cameras open. That way our teachers will help you out to correct the postures. So sit comfortably, your neck and spine should stay erect, chin parallel to the ground. Rest your hands onto your knees. You can keep your eyes gently closed and keep observing your breath. Breathe in deep. Breathe out slow. As you breathe in, observe your abdomen is bulging up. As you breathe out, observe it's sinking in. Bring yourself here and now in the present moment. Bring a bright smile onto your face. Okay, you can open your eyes now. Now a few stretches and we'll do some warm up for the before we actually go into the asanas. So sit up straight, right hand to the right, slide it down. Okay, now you should be able to see. Slide it down to the right, left hand up, and keep looking up. Come back to center, left hand to the left, slide it to the left, right hand up, and look up. Come back up, right elbow down, left hand up, breathe, and keep looking up. Come back to center. Now slide your left, keep your left elbow down, right hand up and keep looking up. Come back to center. Now inhale, both the hands up, look up. Exhale, bring your forehead down. Inhale, come back up, stretch up. Exhale, one more time. Inhale up. Now keep your both the hands behind your hips. Now lift your hips up, drop your head back. Come back to center one more time. Hips up, head backwards. Wonderful. Okay, let's stand up and let's do some warm up. So let's start from the toes. So you can keep your hands on the hips. If you're not able to balance, you can always hold on to something to have your balance. And bring your right leg to the front and circles at the ankle. Clockwise. 5 times. Reverse it. Okay, bring it back. Now left leg to the front. Circles at the ankle. Reverse it. Stop it. Now kick your right leg to the front. 2, 3, 4, 5. Backwards. 1, 2, 3, 4, 5. Left leg. 1, 2, 3, 4, 5. Backwards. 1, 2, 3, 4, 5. Wonderful. Now both the feet together, knees together. Keep your hands on the knees and circles with the knees. Clockwise 5 times. Count on your own. Reverse. 1, 2, 3, 4, 5. Stop. Hands on the hips. Make nice big circles with your hips. You can spread your legs little wide and circles. Count it 5 times. Reverse it 5 times. Okay, stop it. Now, hands by the side of your shoulders. Swing it to the left. Exhale. Inhale, come back to center. Exhale to the right. Look over to your the hand which is going behind, and keep doing it dynamically. Try to keep your lower body as steady as you can. Okay, come back to center. Stop it. Now, big circles with your hands. 2, 3, 4, 5. Reverse it. 1, 2, 3, 4, 5. Now, hands on the shoulders. Inhale, bring your elbows together and make a big circle with your elbows. Shoulder rotation. 2, 3, 4. Inhale up, exhale, bring it back down. Reverse it. Inhale up, exhale, bring it back down. Wonderful. Okay. Now stand up straight. Look straight ahead. Inhale at this. Inhale to the front. While exhaling, look to your right. With each exhale, try to see if you can look further to your right. Inhale, come back to center. Exhale, look to the left. Try not to move your shoulders. Just to take your gaze to the back. Bring it back to center. Now, inhale at the center. Inhale, look up. Exhale, back to center. Now next chin to the chest. Look down. Inhale, come up. Now gentle neck rotations. People with neck issues, be careful. Do it very slowly or try not to do it. So inhale, half circle. Exhale, half. Two more times. Reverse it. Okay, stop it. Now move your neck laterally. So right ear on the right shoulder. Try not to lift the shoulder. Just rest it there. Feel the stretch onto your left side of your neck. Come back to center. Now this time drop your left ear on the left shoulder. Bring it back to center. Now stretch your hands forward. Spread your fingers wide as you can. And feel this. You should feel the tension between your all the fingers. So circles, palms facing down, and then big circles with your palms. Fingers spread them wide. 5 times clockwise and reverse. Okay, stop at the center and then up and down. Now sideways, both to one side, left, right, left, right, left, right. Stop at the center. Now both to opposite side. Nice. Stop it. Okay, that's it. Let's start. Uh, let's sit down first. We'll start with the butterfly pose. So we'll slowly moving towards the asana. So before squatting, moving into the squat, we will. This is a very good posture to cover. Okay, so sit, stretch your legs forward, then fold them, and try to bring your soles of the feet together. Hold on to your toes, stretch your back up, look up, and keep flapping your knees up and down. Slowly, you can increase the pace. A very good exercise for stretching your inner thighs, groin region. It increases the blood flow inside your lower part of your body. So basically today's asana, we have collected them and designed it that way that they will just focus on the strengthening of the reproductive organs. So this is one of them, a very relaxing pose. Wonderful. Now hold onto your toes with left hand, right hand on the right knee, and press it down. Now hold it and pull it towards your chest. Release it. Now hold your toes with the right hand on the left knee, push it down. Now pull it towards you and release. Wonderful. Now next is squatting. So if you're not able to squat down, you can always use a pillow, a blanket, set of blankets to sit onto it and just fold your knees and you can keep on sitting in this pose. This has lots of benefits, this pose particularly. If you are able to sit, that is perfectly fine. To start with, you can always keep the block or something underneath to have the support. Okay. Okay, once you are in squat pose, hands in namaskara, stretch your back up, keep looking up. Now bring your elbows inside of your knees. Now keep pushing your knees outwards with the elbows, not with the upper arms, with the elbows. And your namaskara, keep bringing it closer to your chest and keep looking up as high as you can. Take your gaze up. Should feel the stretch at your throat, inner part of your thighs, groin region. It's a wonderful hip opener. So people with knee issues can have problems sitting into the squat. So please listen to your own body. If you have any issues in going in transitioning into any pose, you can always come out of that pose. But the pain, which if you feel that pain is good for you, keep doing it. Keep challenging yourself and keep smiling. Okay, release it. Stay in the squat pose. If you want to take a rest for a while. You can sit down, spread your legs out, and keep observing the changes inside your body with a smile. Wonderful. Come back to squat. So if you're not at all able to sit into the squat, come into the squat, you can always sit into show, basically Sukhasana, Padmasana, whichever asana is comfortable for you. So hands in Namaskara. Inhale to the front. Exhale, bring it back to the heart center. Keep your back straight. Inhale up. Exhale, bring it behind your head. Fingers pointing upwards. Try not to bend your head down. Keep trying. Inhale up. Exhale to the front. Inhale, stretch forward. Exhale, back to center. Wonderful. Inhale up. Exhale, back. Inhale up. Exhale, and stop. We'll do one more exercise into the squat pose. It's pulling the rope. So imagine that there is a rope in front of you. Hold on to that rope and keep pulling it down. Keep your gaze up. Try not to bend at your elbows. Your hands must be straight, strong like a bamboo. And keep pulling it down. And go faster. As fast as you can. This particular pose increases the overall strength of your body. Specifically, pulling the rope is beneficial for your shoulders, shoulder blades, neck muscles, strengthening of these muscles. Okay, you can stop it. Relax in Shitala Dandasana. Stretch your legs out, hands to the back, head backwards and relax. You can keep your eyes closed and keep observing your changes inside your body. Wonderful, everyone. Okay, let's come into the tabletop pose. So your both the hands are underneath your shoulders. Both the knees are under your hips. Knee points are under your both the hips. So there is equal distance between your both the hands, knees, and toes. Try to hold onto your mat with the fingers firmly. Do not slouch down between your shoulders. Now lift yourself up strong and then inhale. Lift your gaze up, your tailbone up. Make a nice downward arch at your back. On your next exhale, bring your chin to the chest. Make a nice upward arch at your back. Pull your back towards the sky. Inhale, look up. Exhale, chin to the chest. Inhale deep. Exhale slow. Inhale deeper. And exhale slow as you can. Try to take more time for the exhalation. Keep doing few rounds on your own. Observe the massage, abdominal massage. Observe observe your spine getting warmed up. Last one, inhale deep and exhale, chin to the chest. Come back to neutral tabletop. Okay. Next, we'll do Vagrasana breathing. So, again, check your posture. Exhale, bring your right knee towards your chest. Bring your forehead nose or chin to the knee. Try to see if you can touch it. Now inhale, stretch your right leg backwards, straighten it up. Lift your thigh little more up, then fold it and keep looking up. Inhale and then exhale, knee to the chest. Inhale, stretch up, hold and exhale, slow. Bring it back in control. We are trying to synchronize it with the breath. Slow, synchronous, deep breathing. Last one. Inhale, leg up. Keep looking up and we'll try to hold it there. Stay here for next 5 breaths. If possible, release your left hand and try to hold your right ankle with the left hand and keep pulling your leg up. Keep looking up. 5, 4, 3, 2, and 1. Release it. Change the leg. Let's do it with the left one. Now exhale, left knee to the chest. Inhale, stretch it backwards, lift it up, fold it, keep looking up. And exhale, slow. This asana is also very good for strengthening up your pelvis, your reproductive organs, improves your digestion, especially recommended after a few months after the pregnancy. We can do these asanas dynamically, but we are trying to be mindful by synchronizing it with the breath. Now last one, inhale, look up and try to stay here. So it is absolutely fine to stay here if you're not able to release the hand. Those of you who can, release the right hand and try to hold your left ankle with the right hand and keep pulling your leg up. Keep looking up. 5, 4, 3, 2, and 1. Release the leg. Bring your knee back down, toes together, and sit into Vajrasana, hips on the heels, forehead to the ground. Stretch your hands forward. Full body stretch. Relax. And keep your eyes closed. Keep focusing onto your breath. And a gentle smile. Observe the changes. Okay. Now from here we are gonna go move into Shashanka Bhujangasana. That is also one of the very good asanas for strengthening of the reproductive system. So from Shashankasana, lift your head up here. Keep your hands. Okay. So when we are into Shashankasana, take your hands forward. We are not going to change the movement of our hands. So if you want to watch me first, you can just have a look and then you can go ahead and do it. So from here, inhale, shift yourself forward into Bhujangasana. Inhale, look up. Exhale, go back into Shashankasana. Inhale, shift yourself forward and go back into Shashankasana. We do it a few times. If you want a little more deeper stretch, you can always, when you go into Bhujangasana, you can lift your knees off the ground. Keep it back and go back into Shashankasana. Do it a few times. Full focus inwards, attention at your breath. Stop it. Okay. Now from here itself, if you want to relax, take few deep breaths and stretch your body a little more and relax. Okay, next is pigeon pose. So Kapotasana. So hands are right there. Come back to tabletop. Tuck your toes in. Lift your hips up to the sky. And from here, lift your right leg up. And now bring your right knee behind your right wrist. Drop your left knee back down. Untuck your left toe. Adjust yourself and bring your hips down. So do it as much as your body is allowing you to do. Do not overstrain your body. Now, once you are here, you can lift yourself up, open your shoulders wide, stretch up and keep looking up. So we have so many new students today. So we will not move into Raja Kapotasana or the King Pigeon. We're going to stop here itself. And now from here, walk your fingers forward. If you have a block or a blanket, you can always keep in front of you. And then, or you can bring your head down as much as you can. So, or you can keep your elbows down only here, if this is fine for you, and relax here. If you have a block or a blanket, you rest your head or forehead onto it and stretch your hands forward. This asana is very good for overall building up the overall flexibility, strength of your body. Now, rise back up, walk your hands uh, backwards here, stretch up one more time. Now, tuck your left toe back in, lift your right leg back up to the sky and bring it back down. Let's do it on the other side. So, lift your left leg up. Bring your left knee behind your left wrist. Bring your right knee back down. Untuck your right toe. Slide it back down, bringing your hips down on the ground. Do it as much as you can. You can always, again, there is one more variation here to feel little more uh, balance here. You can always have the block underneath your right thigh and keep lifting yourself up. You can always use support wherever you want. Now walk your fingers little behind, shoulders wide, look up. The back knee is in contact with the mat. Okay, now walk your fingers forward, come all the way, bringing your all the way down, bringing your forehead to the ground or on the block. Stretch your hands forward and relax. Okay. Remove the block or the blanket, lift yourself up. Now, tuck your toe back in, right toe. Sweep your left leg back up to the sky and bring it back down. Now walk your toes forward, come back to up to the middle of your mat and stand up straight. On your next inhale, gently, slowly straighten yourself up, hands above your head and bring it back by the side of your body. Now keep your both the first stand up straight, keeping first we will bring our awareness again back to the body. Stand up straight, lock your lower part of your body, lock the lower part of your body. Stretch yourself up and relax. Keep your eyes closed, full attention on your breath and a gentle smile. Okay, you can open your eyes. Now you can keep your both the feet hips width distance apart, parallel to each other. Stretch yourself up one more time. Inhale, hands to the horizon or at the shoulder level. On your next exhale, shift your weight into your heels. You should be able to lift your toes and then bump your hips to the back. Shoulders squared, and then try to go lower down. Try to sit onto that imaginary chair, Utkatasana, and stay there. Do it as much as you can. If your body is shaking, your knees are shaking, legs are shaking, we are building up the strength. And keep smiling. Inhale, come back up. Bring your hands back down. Wonderful. One more bright smile. We have done it. We'll do it one more time. So we'll try it. If you're not able to do the next variation, you're always free to do the same variation. Now hands to the horizon one more time. Inhale. This time, if possible, lift your heels up off the ground. Shift your weight onto your tippy toes. It's perfectly fine to stay here. If you want to go further, bend your knees on your next exhale and go down, lower down, slowly, gently. You can keep looking at a focal point which is not moving. That will keep your balance. Lower down as much as you can. Wonderful. Let the legs shake. Let it build up the strength. Wonderful. Inhale, rise back up. Heels down, hands down. It should be the other way. Hands down, then heels down. Okay, nice. Now take a maximum distance between both your feet. Spread it on the mat as wide as you can. Now hands, you can rest for a while if you want to, always between the practices, even if I don't guide you through it. So inhale, hands by the side of your shoulders. Now shift your right toe to the right. Bend down, keep adjusting the back foot. Now lower down a little, gently, slowly. Try not to shift your knee or sway on the sides, or try not to bring it like all the way to the front. And then come down a little more, a little more. Keep adjusting the back foot. So one day our thigh with the practice will come parallel to the mat. And keep looking to the right. Left hand, there is a tendency your left hand goes down. Bring it up. Feel the strength of a warrior inside you. And keep looking to the right. Pull yourself a little bit to the back. Warrior 2. Again, the strength building asana. Inhale, come back up. Bring your right toe back in. Left toe to the left. Adjust your right foot accordingly. Inhale, hands at the shoulder level. Exhale, bend down. Keep adjusting the foot back or back there. Right foot. Torso to the front and your gaze is on your left. Lift your right hand up. Yes. Little more down. Little more down. Wonderful, warriors. Inhale, come back up. Bring your left toe back in. Again, one more time, right toe to the right. This time, first bend your right knee here. Lower down, little more. Now, try to push yourself little more. If you have been doing this, little more lower. Try to see if your thigh is coming parallel. This leg must be perpendicular to the ground. Bring your right elbow onto your right knee. You should be able to see your entire foot. extended angle. Now, once you're here, lift your left hand up and bring your left bicep by the side of your left ear and keep looking up toward the sky. So your left hand and left leg must come in a straight line diagonally. So there are certain variations here. Half bind, you can bring your left hand back here. You can even keep your left hand up here and release the right hand and bind it from behind and stay here. So if you're practicing that, you can always free to do that. Inhale, rise back up, straighten your leg up, right toe back in, left toe to the left. Adjust yourself, lower down, bend your left knee, little more down, left elbow on the left knee. Try to see if you can see your entire foot here. Now, this shoulder, try to open it a little and then lift your right hand up and keep looking up. And stay here. To go a little more deeper into the pose, you can always release the left hand, bind it from behind. Inhale, come back up. Bring your both the feet together. Stand up straight, focus on your breath. Relax. And a gentle smile again. As Guruji always says, a gentle smile changes the aura around us. So always keep smiling. And it happens. He says the truth. Okay. Okay, let's sit down now. We'll do some sitting asanas. Focus on today's subject. So your legs stretched out to the front. Sit up straight. Your back must be straight. You can keep your hands by the side of your body. Shoulders wide. Now, hold your right leg here. Bring your sole of the right foot. Touch it from the inside of the left thigh. Pull it all the way towards the perineum or as much as you can. Stretch yourself up one more time. Now inhale, both the hands up, look up. Exhale, come forward as much as you can. Once you feel you have reached the final destination here, try to hold on to your legs, on your knees, shin, wherever it is possible for you today. Keep looking up. We are not looking down yet. Keep pushing your lower back forward, middle back a little forward. Adjust yourself. Once we are here, on your next exhale, try to bring your elbows down. Exhale, exhale, exhale. So one day, if you have not been practicing this particular asana, it's not possible that you will bring your elbows down, but with the practice, it will come. So then gently, slowly, with the next exhale, try to bring your forehead or chin down onto your knee. Move into the pose as much as your body allows you to do. You can stop anywhere between the process. You don't need to go to the final pose. There is no final pose in yoga. So that's it. Inhale, come back up. Stretch up, bring your hands back down. Wonderful. So we did a forward bend. To complement it, we are going to do the backward bend. So whichever leg is folded, that hand will go behind. Okay, now left hand to the front. I will show you this way. Now left hand to the front, right hand backwards. So whichever leg is folded, that hand will go behind. This is do it very carefully. If you do the other hand, you might hurt yourself. So pay attention. Right hand backwards because my right leg is folded. Left hand to the front. Try to bring your left toe down on the ground. Lift up, lift your hips up and go back. Okay, come back to center. Hips down. Nice. Now stretch your right leg to the front. This time fold your left leg. Bring your left sole of the foot from the inside of your right thigh. Pull it towards the perineum as much as you can. Stretch yourself up. Inhale, hands up, look up. Exhale, come forward as much as you can. Hold on to your toes, shin, onto your leg wherever it is possible for you today. Keep looking up. Keep pushing your lower back little forward, middle back a little forward. On your next exhale, elbows down. And after that, on your next exhale, try to bring your forehead to the leg. If it's not happening, that is fine. Inhale, rise back up. Bring your hands back down. Now this leg is folded, so left hand will go behind. The same hand. Right hand to the front. When you lift your hips up, try to bring the right toe back onto the ground. So inhale, lift your hips up, go back. Wonderful. Come back. Stretch your left leg forward. Okay. Now spread your legs wide as much as you can. Keep your hands down and try to shift your weight onto the perineum. Stretch yourself up. You guys are not smiling. Little more smile. Okay. Now inhale, stretch up. Exhale, bring your hands down. So people with back issues, be careful. Do it as much as your back allows you to do, or try not to do this pose. And then once your hands down here, try to walk fingers forward as much as you can. You should feel the stretch from the inside of your thigh. Push yourself a little more if you can do it. Eventually, one day we are going to bring our forehead down. If possible, you can always hold on to your toes and come down. Okay, inhale back up. Now both the hands behind. So we did the forward bend. We'll do one more backward bend. Hips up, head backwards. Wonderful. Come back down. Okay. So as we're in Dandasana, let's do a twist, final twist for today's practice. So sitting back in Dandasana, your back is straight. Fold your right leg here. Now left hand behind your left hip. Try not to keep it far away and try not to shift your weight onto it. So you should be able to keep your back straight. Now raise your right hand up and bring your right elbow from the inside of your right knee. So same leg, same. So right leg is folded and my right elbow is from the inside here. Now stretch yourself up. Inhale onto your next exhale. Look back. Shoulders must be squared. So if possible, try to if you're a little more flexible enough, you can always come forward. Wrap this hand around your right knee. Left hand will go from behind. Try to interlace the finger if possible, and then look back. I know with the practice it will come. Only a week's practice, I think. You all should be able to do it. Release the pose. Okay, now the same leg is folded. This time, bring your right foot outside of the left knee and then fold the left leg as well, so that bring your left heel touches the right hip. We are not sitting on the left heel, okay? So right ankle is touching the left knee. Okay, now right hand behind. So previous pose we did was Marichasana, just so that you know the name. So right hand behind your right hip, left hand stretch it up, bring your left elbow outside of your left knee. Inhale, exhale completely, and look over to your right shoulder. Look back, twist. Okay, release the pose gently. Wonderful. This is Ardha Matsyendrasana. Very good spine, very good for this. Basically, Guruji always says that in India we uh, squeeze our clothes after washing and we dry them. We take out all the water from it. So similarly, this asana helps to release the energy blocks in and around your spine. So now this time, hold your left leg, stretch yourself up, right hand behind your right hip, stretch yourself up one more time, left hand up, bring your left elbow inside, exhale completely and look back. And then if possible, you can always come forward and try to wrap around the hands, exhale completely, look back. Gently release the pose. Okay, wonderful. Now this time, left foot, bring it outside of the right knee. Hold your right leg here. Bring your right heel. It should be just touching the hips. Stretch yourself up. Left hand behind the left hip. Stretch yourself up one more time. Stretch your right hand up. So your ankle must be touching the right knee. Stretch your hand up. Bring your right elbow outside of the left knee. Keep pushing it towards each other. Inhale, exhale completely and look back over your left shoulder. Okay, wonderful. Gently release the pose. Nice. Let's do one more backward bend, Ustrasana, camel pose. This is also a very wonderful pose. Um, so come back into Vajrasana, fold your knees, sit onto your heels. Now rise up, take a little distance between both your knees. So tuck your toes in. You can even keep your toes pointing outwards if you have been practicing. But since there are new students, I would guide you through the initial practice, beginner's practice today. Now, on your next inhale, square your right hand backwards and keep it onto your right hip. Other hand, spiral it and keep it onto your left hip. Keep pushing your elbows together. On your next inhale, keep pushing your hips forward. Drop your head back. Look back. Again, do it as much as you can. If you have any knee issues, be careful. Mouth is closed, eyes are open. Again, do it as much as your body allows you to do. Keep pushing your hips forward, forward. Okay, release your hand, straighten yourself up and release your hands. So we'll do another variation. I think this is also for beginners. We'll not go move into the full Ustrasana. So spiral your right hand backwards, and this time, if possible, you can keep it onto the right heel. If this is not possible, you can keep on doing the same pose. Keep the hand on the right hip and raise your left hand. So we are going to keep our right hand on the right heel. Stretch your left hand up. Keep pushing your hips forward. So we are not shifting our weight onto the hands. We're just resting it on the heel to have the support. And go back. Keep pushing your hips forward. Okay, inhale, come back up. Wonderful. We'll do it on the other side. Spiral your left hand. Again, option to keep it on the left hip, or if possible, try to keep it on the left heel. Stretch your right hand up and look up. Keep pushing your hips forward. Okay, inhale, come back up. Sit back down into Vajrasana. Wonderful. Rest for a while. This is a very good pose for your thyroid. People who have, tilted postures like this, it opens it up, corrects the posture. So very good exercise. Good for your reproductive organs again. So I will not repeat that benefit because we are all focusing on those asanas today. Okay, wonderful. Okay, let's lie down onto your back. So we have so many. Normally we do Surya Namaskaras after the asanas into our regular classes, but today, um, because of the time constraint, we are not covering them. But those are very good, very beneficial for overall health of your body. So lie down on your back into supine pose. Stretch your legs forward. Inhale, exhale gently. Let your body settle down on the ground. Keep your eyes open. Okay. Now, next we'll do pelvic tilt exercise. So we always keep on strengthening, stimulating our body, muscles, whatever. But we hardly talk about relaxing the muscles of our body. So this particular exercise is focuses on the relaxation of psoas and the other core muscles of your body. Okay, now fold your both the legs, heels near to your hips as much as you can again. Now put the hands onto your iliac spine, the bone here. Try to push it, try to hold it little, uh, not too hard, just to feel it. So if you want to look towards me, how to perform it, and always wait. I will show you first. So from here, on your next exhale, try to straighten up your leg. Straighten it as much as feel the right side of the bone is tilting forward. So we are not completely straightening it. We are just uh, stopping right before it straightens up. So you should feel it. Try to press with the hands a little more. Once you feel that it's gonna get straightened up, bring your knee back, bend your knee again, and bring your right heel back to the right hip bone. Right hip. Same with the left leg. Inhale onto your next exhale. You can keep your eyes closed to observe those changes. Full attention towards the body, and then straighten your leg. Keep straightening it slowly, gently, and then bring it back. Let's do it two more times. Straighten your right leg gently, slowly. Full attention to the iliac spine, and then bring the heel back to its resting pose. Now left leg, stretch it forward. This asana specifically relaxes those muscles which are basically which joints our spine and the or iliac spine and the thighs. So a wonderful exercise. I recently got to know about this exercise, so I'll be doing it continuously. Once you are done, you can stop. This also releases the energy blocks from that particular region. So whenever you are depressed or you have some anxiety issues, so it says that that particular region is keeps on holding the emotions. So it's very important to relax this particular part of the body. Okay. Now straighten your legs out here. Hold your right leg. Hold your right knee with both the hands, 2 inches below the knee, and keep pulling it towards your right shoulders. Right shoulder. Little more, avoiding the rib cage. Keep your left leg active. Release it. Hold your left leg. Hold on to it 2 inches below the knee, avoiding the rib cage. Release it. Now fold both the legs. Try to hug on to both opposite elbows and keep looking into that air gap which is forming between your knees and the hands. You can sway gently on the sides. Wonderful. Release it. Okay, so one more important pose for today is we are going to go into Viparita Karni, or the supported shoulder stand. So the first pose, initial pose I would want to introduce you. So fold your both the legs, hands down on the ground. You can always try to reach onto your ankles. On your next inhale, lift your hips up. Exhale, bring it back down. One more time, hips up and stay there. So if you have any blanket or a block, try to keep it under your sacrum and rest your hips on it. So wonderful pose, bridge pose, Kantarasana. Okay, if you have kept a block, you can always remove it. Bring your hips back down. Now this time, keep your legs folded and try to uh, bring your soles of the feet together. This is supine butterfly pose. So if you have a blanket or the blocks, spread your knees wide down. Let your knees rest onto those blocks. If you don't have them, that is fine too. And just stay here. This is a very relaxing pose. Rest. You can rest in this pose. Supta Baddha Konasana. This also relaxes the muscles around your pelvis, groin, stretches thighs, your groin region. Okay, release the pose. We are not holding the poses for longer time today. Okay. Next is Viparita Karni. So if you have a wall near to you, I don't have a wall, so I will just demonstrate it near to the sofa. So please consider my sofa as a wall. So bring your legs against, lie back down first, and then bring your legs against the wall and stretch them out like this. And then if you have a block or something, you can always lift your hips up. Try to keep the blanket down there and keep resting your legs out up here. So contraindications for these poses are if you're pregnant or menstruating, please try not to do this pose today. People with eye problems should not try this pose. But this has immense benefits. Increases the circulation, reduces the anxiety, depression. Okay, wonderful. Release it. So without the support, I just want to show you. You can stay there as long as you can if you want to. Just do this asana on an empty stomach. So lie down. We'll do it without the support. Bend your leg down here. Stretch your legs up. Lift your hips up and try to support it with both the hands. So your back must be 45 degrees and legs must be straight. So slowly, gently bring your hips back down, carefully, with caution, and release your legs out. That's it for today. Let your legs straighten them out. Let your toes fall apart. Hands by the side of your body, palms facing up. Keep your eyes closed and full attention towards your breath. Let all the tensions from your mind and body go out. Let your body completely relax. For the past 1 hour, we have consciously stimulated our mind and body. So, this is the time to consciously relax it. Keep that bright smile onto your face. As you inhale, observe your abdomen is bulging up. As you exhale, observe it sinking in. As you inhale, all the positive emotions, energy, enthusiasm, boldness, courage, compassion, kindness, love is going inside of your body. As you exhale, all the negative emotions, lethargy, miseries, pain, body aches, ego, hatred, jealousy is going out of your body. Breathe in and out with this feeling and the belief. Now, bring your attention towards that part of your body which I'll be saying. Try to deeply wish and relax that part of your body. Now, bring your attention towards your toes. Gently wiggle them and relax them. Bring your attention towards the soles of your feet, your entire feet, ankles, shin bone, shin muscles, kneecaps, entire knee, entire thigh region, pelvic region, hip region, genitals are completely relaxed. Now that the lower part of your body is completely relaxed, we'll chant Akara. While chanting Akara, try to find the vibration inside the lower part of your body. Breathing deep. Now, gently bring your attention to the middle part of your body. Bring your attention to the lower part of your body. Deeply wish to relax it. The middle back, the upper back, shoulders, shoulder blades, your entire abdominal muscles, chest, collarbones. Gently wiggle your fingers and relax them. Your palms, hands, wrists, forearms, elbows, biceps are completely relaxed. Now, the middle part of your body is completely relaxed. To enhance the relaxation, we'll chant Ukara on your next inhale. Gently bring your attention to the upper part of your body. Relax your neck muscles, throat, your chin bone, entire mouth region, lower palate, upper palate, tongue, teeth, your lips. Bring a bright smile onto them. Your cheeks, cheekbone, nose, eyes, entire eye muscles, eyeballs, eyelashes are completely relaxed. Eyebrows, eyebrow center, forehead, your ears, your entire head region is completely relaxed. Now, to enhance the relaxation, we'll chant Mokara. Try to find the vibrations inside your upper part of the body. On your next inhale, now the complete body is relaxed. We'll chant A, U, and Mo all together. While chanting Omkaras, try to find the vibrations from the lower part, gushing from the lower part of your body towards the head region. On your next inhale, okay. Okay. Now gently start to wiggle your toes, your fingers, and whenever you're ready, without disturbing your relaxation, try to come to a sitting position. Take your own time, do not hurry up. Okay, sit up straight, keep smiling. Thank you very much for joining today.
Thank you, Shubhangi. That was wonderful. Excellent pointers, excellent poses and instructions. Thank you. Appreciate it. I would like to invite Dr. Ketan Patel to enlighten us on the many female reproductive issues and reproductive issues in general that he deals with on a daily basis. Dr. Ketan Patel.
Thank you. That was a wonderful presentation. Appreciate it. Thank you. Dr. Rashmi Vaidya asked me, and I said, like, let's keep it informal. I don't have a presentation. I want to talk to you guys. It is better to be informal and be in a kind of a family environment rather than being formal in a conference. So, as Rashmi said, I've been practicing this one over 20 years. Most of my career is based in Phoenix. I came to Phoenix in 2002. Over the years, what we have learned about female infertility is that the prevalence of female infertility is increasing. It is increasing, and the most common reason it is increasing is because people are putting off the family bearing or child bearing later and later in the life. That's like number one reason we can identify for the process. So what I wanted to tell you was kind of a big bucket items. What is common definition of infertility? When should you talk to your doctor? Number two, what are the common reasons people have infertility? And number three, what are the common treatment options people have it? So those are the three things I wanted to talk to you. Commonly accepted definition of infertility is that when couple is together for a year, have not used any contraception for a year, and they are not pregnant, then they should come and talk to the doctor. They should, so that's a common accepted definition. Now there are some exception to it. So what are the exception? If you're over 35, female, then 6 months, no pregnancy, then you should go and see the doctor. If your menstrual cycles are not regular, so commonly accepted normal menstrual cycle is between 25 to 35 days. If it is anything shorter than that or longer than that, then you should go and see your doctor. If you have a significantly painful menstrual cycle, then also you should not wait for that long of a period and go see your doctor earlier. If somebody has a history of a sexually transmitted diseases, then absolutely they should go and see the doctor. So these are the commonly accepted definition of infertility. Now, why so? There are two groups of couples. One we would call it as a fertile couples, and one we would call it as infertile couples. Fertile couples have a good fertility rates. Good fertility rates in a humans is somewhere around 25 to 30% a month. Infertile couples have somewhere between a 0 to 4% chance of a pregnancy, per month. So when a couple has to wait more than a year to get pregnant, now they are in a group of infertile couples. That means their chance of monthly conception is between 0 to 4% instead of a 25 to 30%. So that's a commonly accepted definition of infertility, and that's a reason you should go see a doctor, at that point. Now, what are the common reasons we see infertility? The common reason we see infertility, actually, believe it or not, but number one reason is a male problem. Almost 40% of the couples we see has some kind of sperm-related issues. So that's the most common of it. Other patients, they have a lack of ovulation. They have endometriosis, and we'll touch on all of them. And then, other more common is age-related decline in fertility. So let's start with the age-related decline in fertility. As I mentioned before, that the most common reason the infertility rates are increasing because women, general society in general, is putting career first over the family. That's a very commonly accepted reason now for the increasing rate. There's a difference between a physiology of a man and a physiology or reproductive physiology of a man and a reproductive physiology of a woman or women. The men make sperms way later in their life, even in 60s and 70s. Versus women were born with their fixed number of eggs at the time of birth. They have a fixed bank, and over the years, they spend, certain number of eggs per month to ovulate one egg. So back of the envelope calculation is that women are born with somewhere around 500,000 eggs, and they lose it in a 50 years. And in 50 years, they turn menopausal, and that means they don't have any eggs left, and that means no hormone production. In other words, they lose a lot more eggs to just ovulate one egg. Now, body nature screens eggs or egg quality. Better quality eggs get ovulated first. That's the reason younger women, don't has as much time having infertility, fertility compared to the older women. So as women get older, particularly after 30s, early 30s, there's a definite and a yearly increase in infertility rates. That is directly related to two other things. One is a rate of miscarriages and a rate of Down syndrome related problems. So as an example, Down syndrome risk at a woman who delivers at 20 is every 1 in 2,000 deliveries, versus at 35 is 1 in 350 deliveries, versus at 40 is 1 in 100 deliveries. So it significantly increases with the age. And similarly with the miscarriages, we rarely see miscarriages in a 20-year-old patients, versus women in early 30s have a 30% rate of miscarriage, and women in 40s have like 40 to 50% risk of miscarriage. This is directly related to the age of the women. So, as I said, what we see is patients now mostly consulting for, late onset for their family, start, which is, late 20s, early 30s. Other common reason for women, not getting pregnant is not having a regular ovulation. Irregular menstrual cycles are not uncommon. One of the commonest problem with the irregular cycles is called Polycystic Ovarian Syndrome, PCOS. In a Polycystic Ovarian Syndrome, patients or the patients with Polycystic Ovarian Syndrome, their pituitary sends excess signal called luteinizing hormone that makes more testosterone than the women need, because all estrogen comes from testosterone. So more testosterone makes them not mature their eggs, and they have a male-like problems, which is facial hair growth, central weight gain, more around belly, poor cholesterol, and they have an increased risk of diabetes. That diabetes risk is not only extending into the pregnancy, but later in the life too. Third common cause of infertility is painful menstrual cycle, which indirectly saying increased risk of something called endometriosis. Endometriosis is a disease where there is a microscopic bleeding inside the pelvis at the time of a menstrual cycle. Endometrium is a inside lining of the uterus. And when that bleeding happens outside, similar bleeding happens inside the pelvis. Over the time, that bleeding causes scarring and inflammation. That inflammation and scarring is associated with, infertility, painful menstrual cycles, and painful intercourse. Sometimes that endometriosis, implants can come through onto the bladder or bowel, and those women have a bleeding into the urine or the bowels at the time of menstrual cycles. So these are the three common causes, of infertility we see. Now, obviously, if patient has a history of a sexually transmitted disease, which is most commonly we're talking about diseases like gonorrhea or chlamydia, which is very prevalent in a younger age population, teens and, early 20s, that is more likely to block their fallopian tubes, and that is more likely to cause, infertility for them. Um, um, Other way, what at least in America, what we see is a recreational use of testosterone and marijuana that is more commonly associated with infertility in a male population, which is very, very, very prevalent too over here. I have a good number of patients, of Indian origin in my practice, over here in Phoenix. And what we have learned over the time that all these three things that I talked about actually happen to be more prevalent in Indian sub-origin patients too. So let me point out one thing which is probably not very well known, but it is known within the infertility specialist community. Indian subcontinent patients in general have much lesser available pool of eggs than any other ethnicity we see. So if you compare age by age, yeah, Indian, subcontinent patients will have a lower what we call as ovarian reserve, you know, compared to other patients, and they tend to face infertility at much younger age than other population, because majority of our population is Caucasian, white, Americans. Compared to them, they have a much lesser number of eggs, much lower success rate with any infertility treatment, and a need of a more aggressive treatment. Second thing, second thing is that, polycystic ovarian syndrome. Polycystic ovarian syndrome is a little bit of enigma. There's a chicken or egg thing. Polycystic ovarian syndrome is directly related to something called insulin resistance. Insulin resistance is inability to digest the sugar, in an efficient way. That means insulin is not working as good. So I always joke and say polycystic ovarian syndrome patients, are using their insulin like a, SUV, compared to the hybrid they need to work with, hybrid car, they need to work with. So, now we all know that, Indian subcontinent patient or patient in general, whether male or female, have a much higher risk of, insulin resistance and diabetes. I'm very sure we know that everybody, we know somebody, in a family is affected with diabetes, and polycystic ovarian syndrome is quote unquote, front end of insulin resistance, and diabetes is the back end of insulin resistance, and so we see Indian patients, which is basically fall into not having enough eggs or having polycystic ovarian syndrome, one or other, more or less, most of the time. Unfortunately, we do see endometriosis quite often with Indian patients too, and tend to have a younger population with a severe endometriosis. Unfortunately, we do not know what causes, endometriosis, so it is harder to believe, harder to find out why do they have endometriosis. So these are the common reasons for infertility. As far as the testing goes, very basic testing, which has not much changed over the years, but, we always put a first requirement, when the couple comes to us, is that, what's the first test should we do? And obviously is a, male and a sperm, sperm analysis, because 40% of the men we find the problems. Then ovarian reserve, then fallopian tubes, and then general, like, thyroid, hemoglobin, and so forth. So, now sperm analysis is very simple. Unfortunate part is that none of the fertility, testing is perfect. None of them. Numbers don't mean anything until you have a pregnancy. So that means, even though we find good ovarian reserve and a good sperm count and good ovulation and good open fallopian tubes, and they're not pregnant. And those patients are called unexplained infertility, and that tells you the limitation of the testing. Limitation. The most difficult part of the infertility testing is ovarian reserve, because we don't get to see the eggs unless somebody had in vitro fertilization, IVF. IVF. Now, so there are some hormone levels you can test, particularly something called anti-Mullerian hormone that has become very widely accepted as a marker of ovarian reserve, which declines with the age because women have fewer and fewer eggs as they age. Then, ultrasound to count the number of growing eggs, which is called a follicular count. That is also an accepted marker for the for the ovarian reserve, and again it declines with the age. Fallopian tube test requires a small procedure: put a little catheter in the uterus, put a dye through, and take some X-rays and make sure your tubes are open or not. Just 10-minute procedure. As far as the treatment option goes, there are three major treatment options. One is a surgery. Other one is something called ovulation induction with intrauterine insemination, and the third one is in vitro fertilization. Patient with a suspected endometriosis can consider surgery for endometriosis. Initially, early 90s, everybody with infertility used to get laparoscopic evaluation of the pelvis. Over the time, people have realized that, if 3 dozen patients were to do laparoscopy, only one patient got pregnant after the surgery. So routine use of laparoscopy in infertility evaluation is not recommended anymore. But in a sub-selected patients who have infertility, significant, painful menstrual cycle, if they have a cyst on the ovaries, something like that, they can consider it. Beside that, two major options are using the fertility drugs and considering intrauterine insemination or something called artificial insemination or in vitro fertilization. Intrauterine insemination, basically you get the timing right with some medication to the woman and then deliver the sperm at the right time at the right place. Versus in vitro fertilization, woman gets a series of injections for days, harvest the eggs under anesthesia, and get the sperms, fertilize them in a petri dish, make embryos, and then transfer the embryo into the uterus, which is a high-tech procedure. Just to simplify the difference between those two, insemination process is an older fashioned treatment. IVF is a newer treatment. Insemination is like driving. IVF is like flying. You get there faster, but it costs you more, So that's a simple way to put it in. The advancement in a technology that has happened for the infertility treatment, the major advancement that has happened is in vitro fertilization. Now we can not only make embryos, we can test the embryos for chromosomal abnormality for all 23 pairs. It is called pre-implantation genetic testing of the embryos. And that has significantly cut down the timeline, and it has significantly improved the pregnancy rates on these patients. On the back of the envelope success rate, on an average, insemination process is one half to one third successful than IVF process. Just back of the envelope. As far as the in vitro fertilization goes, in America, CDC, Center for Disease Control, tracks the data for last 25 years, and it is age-based. Age-based success rates in 2019, just again back of the envelope, under age 35, if 100 women were to do IVF, 50 of them will take the baby home. It's 50%. 37 is 35%. 40 is 20%. 42 is 10%, and anybody above 43 is 3%. So between 35 and 40, it goes down from 35% to like 20% or 10%, and that tells you the impact of the age, on the success of IVF, and infertility. So what do I tell my patients? What do I tell my patient is this, look at your ovarian reserve, see where you are, okay? And make, infertility as a project, a lot of my population, female population, infertility, Indian origin particularly, they all work in IT. They know what the project means, So I tell them, look at it as a project, see how many obstacles, how many problems you have, collect your data. So what are the commonest problem we see? Obviously there's a medical issue, which is infertility. Then there is a financial part because it's expensive. Then there is a physical part, which is, they have to, kind of a life revolves around the medical treatment month after month and sometimes for years, and then last is the emotional part, where, as far as the, emotional part goes, the most common problem we run into is lack of knowledge and lack of planning, and that gives them a kind of a lack of control. A lot of these women are very professional. They have gotten to this point in their career because they were very dedicated. They were very organized, and they always achieve their goal. And when it comes down to infertility and not able to get pregnant, then they feel that things are out of control. So giving them some planning, giving them some roadmap gives them a partial control back. As far as the stress reduction goes, there is a big part of the infertility. We believe it is related to stress. Unfortunate part of the stress and infertility is that there's no standard parameters to quantify the stress on the infertility process. So as an example, there are patients we see. I see patients who are professional athletes, who are marathon runners. They are lawyers and attorneys, and stress of the job, stress on a physical body, anorexia, bulimia, all these things. So on one end of the spectrum, we see where they don't have any menstrual cycles because pituitary is completely stressed out and says, no more ovulation. Other end of that spectrum is, effect on a fertility. Now, that is very difficult to identify, quantify that how much is the stress, that causes them, to have infertility. But there are some, good data, particularly related to acupuncture and infertility and, improved success rate particularly with in vitro fertilization. So a lot of my patients routinely consider acupuncture as a way of a stress reduction, in a process of infertility, as infertility. So, now obviously, we can make a standard recommendation for everybody, but in general, I tell patient is look at the root cause of infertility, what you have. Look at the limitation of infertility treatment. Technology is not perfect. Insemination success rate per attempt per month is no more than average 15% a month, which is nothing. So it brings from 4% to 12 or 15%, but still is very low. In vitro fertilization, even in a good success rate, on an average is 50%. So look at the limitations of that, and then look at what is your limitations, in order to do the treatment, and then put those things together and make it a project and say, hey, you know, uh, what we want to do as a couple to get it over. Because I can tell you, other end of it is that once patients get pregnant, few years down the road, they don't even remember how they got pregnant, what they went through, because it's just a blip on a on a radar. So make it a project, be aggressive, get it over, and so you don't have to look back. That's in a brief.
Thank you so much, Dr. Patel. That was fantastic. I did not know that Indians had a lower egg reserve. Why do you think that is? Is it
I
Indians or Southeast Asians or what is it?
mostly Southeast Asians, I see across, I see it. And, it's genetics.
Ah,
There's genetics. I always tell almost all of my patients, our ancestor learned. That's a reason, they wanted you to have the kids in early 20s.
that's interesting. Yeah,
We are following, like, and not we, everybody,
yeah.
the two things are very common. Women are getting in the forefront of the workplace. The career is in the center of the family. That's our social reality. We can't deny that one. And we following Western culture, Western food, Western thing, and we see it all the time. Believe it or not, there's a very young Indian population in America. They're looking for donor eggs because they don't have enough. We're talking about this Indians, average group is under age 35.
Sad.
Yeah, so so probably it is genetics. Okay, genetics. And if you look other way, over last 20 years, changing lifestyle in India in particular has brought out epidemic of diabetes. you know we all are aware of that one. And that has related to more occurrence of polycystic ovarian syndrome, that we believe, because it is chicken or egg thing. The genes were dormant, and then environmental factors come in, and they bring it back, bring it out. And we see large number of Indian patients, they're PCOS.
Well, that's awesome. Thank you so much. There are a lot of other questions, but I want to quickly move on to my presentation because I think I might be able to clarify some of them, and then we can take the questions. Stick around, guys. I know this is just 10 minutes close to 6 o'clock, which was closing time, but please bear with me. I will share my screen and open up my presentation. Please let me know if you cannot see it. Is everyone able to see? Can someone speak up so I know that you can see?
Yeah, it's coming up, Rashmiji.
Can you see my beginning slide?
Yes.
Yes, yes.
Okay, awesome. So I'm going to talk briefly about how yoga is going to be helpful for reproductive health. Dr. Patel has already given us his core wisdom from his years of practice. I'm not seeking to, replicate that. Just want to touch on a few points here. That when we are talking of infertility, like Dr. Patel said, he gave us the definition, the hows and whys of it. And like he said, the sperm DNA is affected equally. And the sperm DNA, the interesting thing about it is that it is inert. So there are no DNA repair mechanisms in a sperm because the DNA is inert until it is activated. So your dietary, your lifestyle behaviors are going to affect that, and there will not be a repair done to that sperm DNA, and it will be carried forward into the embryo. Now, when the oocyte and the sperm meet, the embryo has its own repair mechanisms which might work, but they are not always infallible. So, lifestyle changes can bring about epigenetic changes in the sperm DNA quality, which will definitely affect it and affect fertility. So to the point of the question, does it affect males? Yes, definitely it does, which is why you see 50% of cause of infertility is in the males. And smoking, alcohol, environmental exposures, viral exposures will definitely contribute. Advanced age, even though the sperm DNA is inert and is somewhat more protected as it ages, there is a limit. There are cases of autism with advanced paternal age as well. So just like Dr. Patel mentioned, polycystic ovarian syndrome is the big bad guy in the infertility world. And so here we see insulin resistance is where it all starts. Like it said, it's a spectrum. You start from being insulin sensitive at birth, and the more crap we eat, the more insulin resistant we become. So it would be 10 years by the time you're fully insulin resistant, few more years before you actually manifest diabetes. So diabetes is actually the really bad end of it. When you show up glucose in your blood, you show up glucose in your urine. So a long time before that, you got to this point of being insulin resistant. It causes metabolic syndrome, which is, high blood pressure, having lower HDL, and hypertension, glucose intolerance, and ultimately type 2 diabetes. So what has been found here in polycystic ovarian syndrome is also there is a imbalance between your sympathetic and parasympathetic system, the hormonal imbalances that are caused there. Just like Dr. Patel mentioned, increase in the amount of testosterone, which is unusual for a female, therefore the male pattern growth, hair, etc. So what yoga did in these people is we can improve insulin resistance and all the metabolic parameters that affect these women. So going into more detail about the metabolic syndrome, if you have a large waistline, be aware of it. There could be something like that going on in the background. Check your triglycerides, check your LDL, check your fasting blood sugar, and probably more importantly, check your insulin after a meal. So do a testing where you're doing not just glucose testing after meals, not a glucose tolerance test, but an insulin and glucose tolerance test. Check your blood pressure. And why do we worry about this? Because at the end of the day, the end organ damage with stroke, diabetes, heart disease, kidney disease is going to increase the longer you have these problems and the worse they get. Again, Dr. Patel mentioned endometriosis. And here, unfortunately, there's not much to do in the way of prevention, perhaps, but we could try to control the symptoms and help with relaxation of the pelvic musculature, the urogenital diaphragm, and help with the pain with meditation. So what are we talking about? So these are the muscles that we worked on today. So to put things in perspective, these are your kidneys here on both sides. This is the aorta branching into the iliacs. This is the inferior vena cava, which is the largest vein in the lower body, bringing up all the blood back to the heart. Aorta is the one that supplies the blood. And here you see the ureters climbing down into the pelvis, going towards the urinary bladder. And you see this muscle here. This is the psoas muscle. This is what Shubhangi was trying to show us, which is being relaxed when she was doing the pelvic tilt. The anterior superior iliac spines are here. This is what she was talking about, relaxing the psoas, lengthening the psoas, which is at the core of our body really, and which is where we women especially tend to hold all their tension. So consciously, unconsciously, you tend to hold that and tighten it the whole time that you're walking around, upset, angry, holding a grudge, whatever it is. You're doing that. So your fight or flight reaction shows up very much in these muscles. And that is why it is important to relax these core muscles here, as well as the iliacus. Very important structures here at the core of the pelvis. These are some of the ligaments you see that are supporting the structures in the pelvis. This is a view from top down into the pelvis. You see the urogenital diaphragm. You look at the number of muscles here. These also get constantly held in tension when you are upset, angry, when you're in fight or flight mode. So fight or flight, what is fight or flight? When we are stimulated, we are trying to get away from a threat. We've been programmed to be so that we are not trying to rest or digest. We hold it, everything in, pull up the genitourinary diaphragm, get ready to run away or get ready to fight with a threat. Unfortunately, today we use the same mechanisms constantly during the day for anything such as your family not listening to you, you have an argument at work, things don't go the way you want them to go, and we hold it all in our core. Given how busy this area is, it's not hard to imagine that one affects the other. This is the view from the bottom up. These are the extensive number of muscles that are going around the structures here. And in the next slide, we'll see the busyness of the pelvic arterial supply. So multiple nerve plexuses and also arterial and venous plexuses in the pelvis, which are really responding to every emotion you have. So it's like, the spider and its web. The spider knows every time there's a vibration at one end of the web. Similarly, your body and every cell of your body knows when you're upset, when you're angry, and when you're happy also. So there is this very wired, I always say the pelvis is very wired. And so these are the wires, these are the nerves picking up on all these contractions, all these problems, and really all the structural issues that are coming up here as well. So the sympathetic outflow is craniosacral, meaning more in your neck, and the parasympathetic outflow is craniosacral, so more in your head, face, neck, and more in the pelvis. And the sympathetic, which is the stimulatory outflow, is in the more in the thoracolumbar region, which is in your chest and in the lower back. And a side view of the pelvis here, we can see the urinary bladder, the uterus, and the rectum. Look how closely opposed all these structures are. Is it any wonder that problems in one spill over into problems of the other surrounding organs? And the fascia in which they are invested and the muscles that are closely opposed to each other. This is the peritoneum, which is the layer which is covering all the pelvic organs, separating them from the abdominal organs. And here is a free view of the bladder, the uterus, ovaries, one on each side. These are the ureters coming down, coming from the kidneys, bringing your urine down to the bladder. And this is the rectum. Down here is the vagina. So how can yoga help in fertility? So quite straightforwardly, basically what we saw Shubhangi doing today, these asanas improve the blood flow to the pelvis, they help venous return, they help lymphatic flow back to the heart, and getting you stimulated with an asana and then helping you relax. So this is balancing out the sympathetic and the parasympathetic nervous systems, which are going to maintain your hemostasis. So at all times, our body is striving to maintain balance. Balance is what it's all about. And that is being achieved at a high cost when we are constantly upset, constantly getting angry and holding it all in. So the body does achieve the balance, but it comes at a cost. And at some point, something gives. And what is that something that gives? Ends up with stress, that ends up with you smoking, drinking, getting upset, using food as compensation and reward, lacking in physical activity, sometimes developing depression. So these are what we call as the vikshepa. At some point, the vikshepa, they become imbalanced and beyond correction. So why is yoga useful? It will help you correct these imbalances before they become irreversible, before they come to the point of no return, if you do it regularly enough, often enough, and incorporate relaxation into the asanas, not just stimulating all the time, but also incorporating relaxation so you can develop heart rate variability and tone up the parasympathetic. So stress for the menstrual cycle, Dr. Patel mentioned all the time that stress definitely affects, and cortisol was elevated, which can directly cause anovulatory cycles and amenorrhea. And so yoga would help you relax all these organs, like I said. It also makes you happy. So increased serotonin, brain-derived neurotrophic factor, which are the happy hormones of the body, and it helps you achieve that. Exercise also helps you achieve that. Yoga just happens to be much more wholesome in terms of mind-body interactions. So what is yoga really? It is a step-by-step path to improve our perceptive abilities and work with the body with the asanas, the breath with pranayama, and the mind with meditation and relaxation. So why do we worry so much about stress? So besides all the things that it does to your sympathetic system, it also affects your immunity. So at a cellular level, it's making you more prone to infections. In these COVID times, I'm sure we're all worried about that. It promotes more a stickiness of your platelets. So you're more likely to make clots, increases your cortisol, which directly causes visceral fat. Visceral fat is the fat around your organs, and also the fat in the omental layer, which is like a curtain in front of your organs. Also, it causes you to become insulin resistant and ultimately diabetic. Believe it or not, stress also affects the kind of bacteria that are in your gut. Diet also is a big part of what affects that, but stress also affects beyond that your cytokines. Again, these are immune system mediators which help your immunity, which help your inflammation. Telomere shortening. Telomeres are like, think of it like the ends of a shoelaces that are tightly wound pieces of DNA. And over time, if we stress ourselves out, we shorten the telomeres, therefore shortening our own lifespan. In cases of cancer, it also affects growth and spread of the cancer, but that's beyond the scope of this talk. So why would yoga help? Because it's a whole system modality. It works with your mind and it works with your body. It has anti-inflammatory effects, and it shifts the metabolic function from the sympathetic to the parasympathetic. What evidence do we have for yoga? So in Harvard Mind Body Institute, they did a 10-week program with yoga, relaxation, and meditation, and found a significant difference with a 44% pregnancy rate. That's awesome. I think they, just being able to calm these women down, calm their partners down, tell them to just relax instead of, just trying to go at it like rabbits and hoping for a miracle like week one. So I think just calming down, just relaxing and taking it naturally probably had a very big effect in that, and yoga so definitely helped. So again, in another randomized controlled trial, viable pregnancy rate of 55% as opposed to 20 in a control group, 42% of pregnancies in a yoga group without assisted reproductive techniques. And so support group satsanga, which Guruji talks about so much, is very helpful both at home and outside. So get a support group to help you with what you're doing that understands, that is empathetic. And people with a depression while trying to get it, whether as a cause or as a side effect of it, had also a very good chance of having a viable pregnancy post-yoga. So as far as the metabolic syndrome and the PCOS is concerned, there was definite increase in insulin sensitivity with exercise-induced weight loss, and it helped with inflammation. So we now know that inflammation, chronic inflammation in particular in the body, is responsible for everything from diabetes, insulin resistance, all the way to cancer. And obesity creates a state of constant inflammation that our body is then fighting. Our immune system has this love-hate relationship with cancer. They try to destroy it first, and then they try to help it because they're confused. The cancer cells manage to confuse them. So having a strong, robust immune system to begin with, by not being stressed out all the time, will help you be resilient. We eat all the time. We really, our genetics doesn't change, cannot change in the last 250 years. Our genetics evolves over millions of years, and over the duration of human existence, humans were raised to have to struggle for their food, to find their next meal, not have it stored in their pantry and eat something every 2 3 hours. That doesn't work, because when are you going to burn the fat? It's not there for your looks, it's there for you to burn at some point. And if you keep the fat there and keep eating every 2 to 3 hours, you develop a state of chronic inflammation that then is going to cause all these problems. So it was found to help your blood pressure, blood glucose, fasting insulin, and waist circumference by just 12 weeks of daily 60-minute yoga sessions. This is from the S. Vyasa Institute in Bangalore, studies done by Dr. Nagratna as well as Dr. Lorenzo Cohen in MD Anderson Cancer Research Center. Yoga for hypertension, again, multiple randomized trials have been done. We know that if we simply reduce a reduction of 2 millimeters of blood pressure on the diastolic, we can reduce the incidence of problems and organ damage by 14%. That's huge. So I think the day is not far off when yoga will have to be included as part of a lifestyle modification for all hypertensive patients to begin with, in order to help. Diabetes, I think we talked a lot about it already, but there are multiple now randomized and non-randomized controlled trials which showed improvement in glucose control, fasting, postprandial blood sugars, also HbA1c, which is a parameter of your blood sugar over 3 months. So lipid profiles improved as well as the body composition. And these are my references. Before I do the closing prayer, let me stop sharing and take some questions that were asked before. So I think the first one you answered. Is the number of eggs a woman carries related to her life, to her genetics, Dr. Patel? I think is the next question.
So answer is yes, but we have an average. So there is like a indirect correlation we see where uh, some families go in a menopause later, mother daughter combos. Some families go earlier. So there is some genetics involved, but we cannot pinpoint the genetics. It's like a diabetes. We know it runs in a family, but we can't say what causes, genetical changes causes diabetes, something like that.
Right. So then the next question is, do men experience a syndrome analogous to what women experience as PCOS when they are insulin resistant?
Not that I am aware of, but having said so, obesity in a man, differently affects, the sperms. Obesity in a man, is associated with decreased testosterone, increased testicular temperature, and increased estrogen level, and that affects the sperm, function as well as the quality. But it will be different than PCOS that we see in a women.
Yeah. And then diastasis recti is the scope within today's topic. Diastasis recti is the separation of the recti. The rectus abdominal muscles are this, men are always after trying to get this six pack on their belly. And diastasis is when there is a separation of the two. It's really not related to anything about reproductive health. It can sometimes be seen in certain genetic syndromes. It can happen as part of it. The other thing that could happen is if you start developing abdominal fat, both subcutaneous and visceral, there can be a pronounced, widening of gap between the recti because of loss of tone and increased, fat deposition. So, but really not really related to the scope of today's topic. And then I think the role of mind stress, I believe I covered that. And then lifestyle, I believe I covered that. But again, Dr. Patel, free to touch on it. And then the last one was root cause of endometriosis, and is surgery the only option? I think you already answered the question, but please go ahead.
No, so as far as the diet goes, absolutely. I think you touched very well on it. Um, you know, human genes have not changed over generations. Only things that has changed is availability of the food.
Yeah.
Okay, availability of food. And how do I say? Many times, I tell the patients that obviously, again, you said that our ancestor had to fight for every meal, in order to survive. Um, just think about this way. Certain animals like cows and buffaloes, they keep eating all day long. Okay, do they put on more than certain amount of weight? No, because their genes have not changed. Versus our food availability has changed, and because of that, now I mean, like Rashmi, you're in America. People coming over here, and in the first 5 or 10 years, they put on significant amount of weight. And then, I mean, I see cases over and over again. They come over here, put on weight. Now they start having irregular menstrual cycles, turn into PCOS, and then say, "What happened to me?" Well, it's a weight gain. So I think weight and environmental factors has significant, and the stress has significant connection, with each other.
Right. Yeah. Yeah, absolutely. If there are any questions, anyone wants to speak up, you could unmute yourself and ask a question now. If not, you can send us your questions. We'll try and get back to you. Like Shubhangi kept saying today, you can't learn yoga in a day. And she gave us some beautiful examples of all the different poses done perfectly. You don't have to feel intimidated that you're not there today, but I think there are options available. And even in COVID times, Vivekananda Yoga has been running online programs where you join, you learn beginners classes, learn the poses, learn meditation, learn pranayam, and make yoga your way of life. It's not something that you can do in a day. It needs to be a way of life so that you can get from roga to arogya. So that is the goal. Please reach out. You will have links that would be sent that you can connect with and join for Vivekananda Yoga. And reach out to us for any questions or concerns that you might have. So I would like to close with a closing prayer. Let us come to a comfortable position. Hands in Namaskar Mudra. Om Sarve Bhavantu Sukhinah. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma Kaschit Dukha Bhag Bhavet. Om Shanti Shanti Shanti. So the prayer means that may everyone benefit from this session. May no one harbor hate or anger towards anyone. May health benefit all of us. May everyone be blessed. Thank you all for taking time out from your Sunday evening. Thank you very much, Dr. Patel, Shubhangi, all the teachers, Guruji for inspiration, all the teachers who joined, and all of you participants for showing interest. Thank you and have a great evening.
Thank you.
Thanks.
Thank you so much.